Dr. Sturdy, nice to meet you.
Nice to meet you.
Alright, so it looks like we got your test results back, and it shows that you have tested positive for the autoantibodies that cause latent autoimmune diabetes in adults. We typically call this type 1.5 diabetes.
Okay, I've never heard of this before. What exactly does it mean for me?
So this type of diabetes is pretty rare. It's only diagnosed in adults over 30. It's a combination of both type 1 and type 2 diabetes. Type 1 diabetes, the autoantibodies that attack your pancreatic beta cells and the enzymes that are used in your pancreatic functions. These antibodies often result in the pancreas having problems maintaining blood sugar levels. It's also similar to type 2 diabetes with insulin resistance.
So is this condition treatable?
This type of diabetes is slow progressing, but unfortunately it is not curable. With the right treatment plan, I think we can prolong your insulin dependency. Can you describe some of the symptoms you've had recently?
Yes. So recently I've been experiencing blurred vision, frequent urination, I have to go to the bathroom a lot, fatigue, my skin has been really dry, and I've had a lot of tingling in my feet recently.
Alright, and along with the high levels of sugar we found in your blood and urine samples, those are all symptoms of type 1.5 diabetes.
So exactly what will my treatment plan look like?
So first, I will send you in a prescription for metformin, which I'm going to have you taking daily. I'm also going to give you a list of foods that have low glycemic index, which will help avoid spikes and crashes in your blood sugar. I'll put you on with one of our best nutritionists here. Physical activity is also going to be a very important factor. Do you exercise regularly now?
I used to exercise regularly, but recently when I exercised, I experienced like extreme fatigue and dizziness, so unfortunately I stopped exercising.
So this is most likely due to your blood sugar crashing when you exercise. Diabetes can make exercise very difficult because you kind of have to plan it out according to your blood sugar levels. The best time for you to work out is about 1 to 2 hours after a meal. And I think that'll help with your fatigue and dizziness that you've been experiencing.
So are there certain exercises that I should do now that I've been diagnosed with this?
So high intensity exercises, running, jumping, those are not going to be good for you because they're going to increase the risk of injury to the tissues in your feet, which are already vulnerable, especially with the tingling you've been experiencing. Low impact exercises are going to be the best option. I'm going to recommend walking for about 30 minutes a day, as many times a week as you can, and some core and stability exercise would also be great for increasing your health without straining those weaker areas. And I'm also going to recommend that you have a snack handy when you do work out, just in case your blood sugar levels drop too low.
Okay, so this all sounds very manageable. Is there anything else that I need to know moving forward?
It looks like prior to this diagnosis you were pretty healthy, so I think if you follow this plan, we can prolong your insulin dependency for quite a few years.
Okay, great. Thank you very much, doctor.
Of course.